So, uh, so thank you. I'm Dan Nash. I'm the Chief Information Officer at Emanate Health, which is a health system here in San Gabriel Valley. I also act as the Chief Information Security Officer. You'll also be hearing from my colleague, Eric Maristella. He is our Compliance Officer for the organization. So, let's see. Technology, right? There we go. So Emanate Health is a 3-hospital system. We have about 24 ambulatory clinics. We run a home health agency, and we service San Gabriel Valley, well, Eastern San Gabriel Valley, about 1 million lives. You're going to get a different perspective on cybersecurity from our talk. It's going to be more on the healthcare industry and the effect of cyber to us. So you've seen this, or if you haven't seen this, this is what's in the news since what, January 1? So these are some of the attacks that hit healthcare just in the first month of the year. So as you see, some of the things that they hit us with, email data breaches, extortion of data, that on here is Lurie Children's. So it's a large children's hospital in Chicago. It got hit in the beginning of the year. The prior speaker was talking about, it's not life and death, right? It actually is for healthcare. When our records get tied up, the physicians don't necessarily have all the information on the patient, which is really scary sometimes. You see, recently there was a hack to Change Healthcare. It's all over the news. I mean, it's with Change Healthcare, they hit the prescriptions. They hit the claims file, the payment processing, which is also really, really important to the industry, because without that information, you can't go get your meds, right? There was major disruption to prescription management. So if you were on a particular med, now you're going to the pharmacy, your local CVS, and they're like, well, we have no record, or we can't process this prescription because we can't get paid for it. So then you're doing out of pocket, say, okay, well, this drug I need to live, so I'm going to pay the $1,000 instead of $10, right? So it's huge in terms of the attack vector for healthcare is just, it keeps me up every night. So threat landscape. So we have a managed service provider called Kroll. Kroll is really good at doing forensics. They're really good at doing MDR. So what MDR is and EDR, so between the differences, EDR is endpoint detection and response. MDR is managed detection response. So as a healthcare system, our primary duty is providing healthcare. So I don't employ a bunch of security engineers, right? I do buy that service from Kroll. So they have a whole team of engineers that are watching our environment 24/7. What you're seeing here is threat landscape from the perspective of Kroll in the first part, between 22 and 23. This is what they saw in terms of their upscale for their customers, that they were getting attacks against professional services, huge uptake for that, whereas healthcare went down on their clients. I look at it from the perspective of, okay, if the attacks have gone down, that's a good thing because they're monitoring us every day, every second of the day. So, which is good for me. Maybe I get some sleep. The most common threat for 22 and 23, as you see, email compromise. Last speaker just talked about it. It's the easiest way for it to get into the environment, right? We do trainings and onboardings for every staff member that comes into our organization, talking about email and how important it is to understand where that email is coming from. Don't just download things. Don't just click on things as it enters the environment, because that's the easiest way, no matter how much protection and detection stuff that we do, in information services, it takes one click to let the virus in, right? The other way, they hit us with ransomware. I mean, literally right now, Change Healthcare, which is a huge organization for this country, it manages payments and claims processing for healthcare institutions across the entire country. It also handles prescriptions, as I talked about. Just for instance, Emanate Health, for the first, so since February 21st, when Change Healthcare got hit, we are now holding over $200 million worth of claims that we're waiting for, that we can't even process to ask for payment. Understand, as a community health system, cash flow is really important. Eric and I want to get paid, right? So making sure that that cash flow is coming in, the claims are getting processed, and then we're able to take care of our patients and buy the things we need, that's hitting us right now, even though we didn't get hacked. So it's huge in terms of ransomware. The rumor out right now is Change Healthcare paid $22 million to get the keys, which is huge, right? Let's see, what else here? Luckily, or unluckily, healthcare seems to be the biggest in terms of the amount of money that we get hit for when they ransomware us. The average price in 2022 was a little bit over 10 million. Now it's up to 11 million. And as I just said, this year, Change Healthcare rumored $22 million. That's huge, huge amount of money that they're asking for. So as you can see, over the past 3 years, average cost of a data breach in healthcare has grown by 53%. One of the things I'm going to talk about is why. Why is it so financially beneficial for the hackers to hit us in healthcare? It's the value of the information. Remember, if we get it tied up, if that physician who is on the floor in the hospital and he's trying to treat a patient, we are all electronic, right? If he doesn't have the information on the patient, how is he going to take care of that patient? I mean, we do a lot in our organization to give downtime options so that the clinicians have another means to get information on the patients that are on the floors or in the clinics. I talked about Lucy Children's in Chicago. One of the things that you don't think about is, okay, the hospital itself got hit, but what about all the pediatric clinics in the Chicago area that use them as a base system for their electronic health record? So every one of those clinics, when your child's coming in and you want to get treated, they're like, oh, the system's down, right? And it's tragic when we get hit. So, and the prior speaker talked about this, but the primary ways that attackers hit us are stolen credentials, phishing, and phishing is when they send an email and there's some kind of information in there that you believe it's true and you click on it or you provide information. And then there's exploitation of vulnerabilities, meaning patch management. So the Change Healthcare hack happened because something was not patched. So these are the attack vectors. And, we talk about healthcare. During the pandemic, the hackers hit healthcare. The increase was 700%. The reason is because we were already at capacity. I mean, at Emanate Health, the emergency rooms were overflowing. The beds were overflowing. It was terrible, right? That was the opportune time for hackers to hit us because am I going to pay to get the hack eliminated so that I can get back to patient care? That's what they figured, that they say, okay, if we hit you now, you're already in dire straits. You're going to just pay us just to get it and move forward. That's how bad it is. So that's the value of the information. That's why they hit us. is because without that information, we can't do good patient care. So, and this is talking about, does everybody know what NIST is? So the NIST framework was put out by the National Institute of Science and Technology, and it's a framework for organizations like ours to sort of map out a strategy to protect the organization, right? So in 2015, when I went and joined Emanate Health, one of the things that came up, I joined at the end of the year, and then I think it was February of 2016, Hollywood Presbyterian, so another local hospital, was one of the first hospitals to get hacked and had to go pay Bitcoin to basically unencrypt the data that got encrypted. I remember sitting at a board meeting with our CEO, and he looked across the table and he said, Dan, what would happen if that was us? And having just joined the organization and looked at where we were, I said, we'd close the doors to the hospital because we weren't ready. So it was really important. That's when we adopted this framework, put things into a structured, and the prior speaker talked about incremental change. Because remember, the business of Emanate Health is healthcare, not cybersecurity. Cybersecurity, we have to do that to protect our business, which is healthcare, and the patient, which is all of you, right? So how do you do it? There you go. So this is what our risk, this is our NIST actual one in 2019. So as you see there, under the NIST framework, it's a 0-5 scale. For healthcare institutions, we try to get to a 3. And a 3 means that we have a documented and managed process that we can follow to make sure that we're hitting the numbers. You'll see other organizations say, like, well, even my board said, well, why aren't we 5s? Because I go back to the business of healthcare. The business for us is healthcare, not cybersecurity. We're not DoD. DoD would be all 5s, right? A 4 means that you measure and you have repeatable things that you can do, measure KPIs, and you improve over time. So we will get to potentially 4s, but not on everything, right? And as you see there, one of the things that's on here, we had to make a decision in 2016 because I go back to our business is healthcare, not cybersecurity. How much money can we spend on cybersecurity versus patient care? It's really important that we reinvest into the organization in terms of our capital funding on patient care. The prior speaker talked about protect and detect. Okay, that's really great, but if you don't even have a response plan in place, how are you going to, respond to an attack so that you can come back to operating healthcare? So in the discussions with the board, I told them, I said, the first thing that we're going to focus on is it's not if, it's when. Because I knew we were going to get hit. It was just ultimately over time, we will be in those crosshairs. So our focus for the organization was on response, incident response. How are we going to respond to an incident so that we can turn it around and get back to our day-to-day thing, which is healthcare? So as you can see, in 2017, we had done a lot on building out an incident response plan. And just so you understand, we do this for every kind of response in healthcare because we're the ones, let's say we have a big earthquake, we're the ones you want to count on that we're there to provide healthcare. Where if there's the fires, if there's the fires happening, we want to be there. If there's any kind of an emergency, we train to incident response so that we can turn around and help the community. That's the key. It's the same thing here in terms of computers. We need to be able to be robust so that we can respond and still continue to provide healthcare. There we go. So response plan: prepare, identify, contain, investigate, and eradicate, which the prior speaker talked about. Recover, lessons learned, and case management. So that is a response plan. So the containment, we look to our engineering, our computer engineers to be able to help us contain the act that came in once we heard about it, right? And it's, okay, how do we get back to business in terms of recovery on those systems? So it's huge. This is our environment in 2019. So what we put in place from, remember, we started this in 2016. We identified that, hey, we're 3 hospitals. We were in a single data center when I took over. Everything was physical servers. So that, you know, we're in an earthquake-prone area, right? So that single data center at the hospital, what would happen if that went? We'd be in deep straits. But we were 3 hospitals with 3 different data centers that we could roll out. So we did that. We basically virtualized the environment, got rid of the old physical servers, and created replicated models across the 3 data centers. So I'm thinking, all right, you know, I got 3 copies of production. And by the way, I also added a copy in the cloud. So our CEO, he's like, so how are we protected now, Dan? I go, Rob, we are so good. I got 3 copies, 1 in production, 2 copies on each of the other data centers, and I'm replicating to the cloud. So we should be just golden, right? I was sleeping every night saying, hey, this is great. And unfortunately, come on, there we go. We actually got attacked in January of 2019. So even though all the prep, everything, we got attacked, ransomware. 151 servers out of 492 servers were hit. Our archival backup systems, email exchange system, our centricity perinatal system, a lot of the third-party bolt-ons, all encrypted. With cyber breach, but the prior speaker also talked about network segmentation. So we did segmentation. They never found our EHR. So they didn't hit the EHR, they didn't hit the financial systems, they didn't hit the accounts receivable system, they didn't hit the PACS system. You have to understand, PACS, which is imaging. So when you go in for X-rays or CTs or MRIs, that's the front door to the hospital. So you show up at the emergency room, and the first thing the doctors are usually doing is saying, okay, we're going to send you for an X-ray, or we're going to send you for a CT, we're going to send you for an MRI. Those are key to keeping the patient flow active in the health system. That didn't get hit, right? And then we all love healthcare, but we don't do it for free. So our Kronos and our payroll system weren't hit either, so we weren't worried about staff. But so what happened? One of the, you know, so here's the environment again. What'd they do? Is this thing working? So as I said, I had 3 copies, 1 in the cloud. I'm really happy. I'm sleeping at night. I get the call. Very sophisticated attack. They disabled our endpoint virus scanning, right? They came in and they turned off the services, not the software. They didn't kill the software. They just told it not to look for any viruses. Smart, right? Then what did they do? So this is actually what they did to us. They took out our backup, our replicated, you know, so I'm sitting there, I got 3 copies, 1 in projection. They deleted them. They also, our data domain, which replicated to the cloud, because I said, oh, I got a cloud backup. They got into the data domain and they deleted all the files, but left the directory structures So when it replicated to the cloud, it basically blanked out everything that was in the cloud. So now the cloud's gone. So there goes the cloud. And then they deploy ransomware on production. Right? So, like I said, really smart attack surface, right? They really understood what was going on in our environment. They looked at everything that was there and they picked it apart piece by piece until they said, okay, we're ready. We're gonna deploy the ransomware. And that's what they did. Okay. So this is the sequence from our incident response. At 2:10 a.m., ransomware was detected. So our PBX operators work for IT, and they understood what to do. And all of a sudden, their desktop is showing ransomware. So they did what they were trained to do. They reached out to the on-call engineer and said, "Hey, I've got something going on my desktop. I don't know where else it is." That engineer got in, started doing investigations at 2:15 a.m. And by 4:20 a.m., they alerted me. Now, during one of the board meetings, our CEO at the time said, I was talking about, hey, if we get hit, these are the things I'd like to do. And he gave me the authority to do whatever is necessary in the event of attack. Even if I was wrong, he says, it's better you apologize the next day than you be wrong, So at 4:20 a.m., we shut off all of our network to the external world and all of our cores internal to the hospital. Every access point, every NIC was turned down so that now all we had was a bunch of computers everywhere, nothing talking to anything. My next call was to the executive team, 4:30 in the morning. I decided, okay, so do I call the CEO or do I call the CFO? Well, I'm going to start with the CFO because he can call the CEO and get yelled at, right? Okay. So I called the CFO, and Roger looked at his phone at 4:30 in the morning and said, Dan Nash calling me. He's either butt dialing me or this is not going to be good, right? So we alerted the executive team of what was going on, and we had a command center activated by 5 a.m. that we were managing. We were working with our outside vendor who Trend Micro to determine what was going on in the environment. We used cell technology to be able to contact them, then open up a port for them to get in. So really leveraging all the tools. And one of the things that we do at Emanate is we create downtime reports that are available to nurses to be able to print out in the event of failure like this. So on the computer unit, on the units, for those systems that weren't ransomware, they were able to go to those computers and access downtime reports and print them physically to the printer connected to that PC and distribute. So now when the angry doctor, he's not calling me up because he doesn't have an electronic system, he's handed a paper. Hey, these are the patients on the floor. Here's their information on what they're here for. Small amount of information, but it's back to basic medical knowledge and being able to work with the patients. So looking at that, we did that. Then we began assessing all the systems. One of the things that my network engineer determined, he was seeing a jabber on the NICs for those computers that were infected. So that's how we identified, okay, there's a jabber on this PC, on this NIC, but there's not one on this one. So we can open up certain PCs that were not infected. And that's what we did. So imagine doing that across 3,000 desktops, right? And 450 servers. We validated that. So that took all day, right? So as you can see, at 7 p.m., we brought up our Meditech EHR, our PAC system, and our Kronos system. Those were the only three we brought up. And then we opened up network activity internally only to those computers that were available. So really, our response plan was huge in terms of being able to bring up the AHR and get back to business. So less than 23 hours, we were up at 11:20 p.m. with internal network and access to the AHR. So our EDs were back functioning on electronic. Sunday, the 27th, we came back, reviewed the response, command center open, and we started to review to clean systems. What that meant is for those PCs that were infected, meaning wiping them and reinstalling an operating system. On Monday morning, and that's what we did all day long to give more access to nursing and whatnot, to the AHR only, and still segregated from the world, right? Monday came and we reviewed status with the E team and our executive team, and then we activated our insurance. So we have cyber insurance. And at that point, that's when the cybersecurity professionals came in and our insurance company basically took over and said, okay, we've got the best team ever that we're going to bring into the organization and try to assess what's gone wrong, right? That's the value of cybersecurity insurance for a healthcare organization is huge. So they brought the best and brightest to come in and assist us. So one of the things that in healthcare, and my colleague Eric will talk about it, is our regulatory requirements and reporting if there is a PHI, protected health information breach. So both the state and the federal government require us to do reporting in the event of release of information inappropriately. So that would have been part of why we have to do forensics to understand where did the hackers go, what did they touch, did they exfiltrate any data? So all of that is part of our response. And our cybersecurity insurance company brings those talents. What do we do? In the 2 weeks after the hit there was a decision by the board to say, okay, we're going to move all of our on-prem EHR. Remember, it didn't get hit, but now they were worried. We're going to put it in the cloud. We're going to put it in a private cloud. And we did that in 32 hours. That's not 8 hours. That's 32 hours from the time they started to move it to the cloud. And we were up and running in the cloud in 32 hours and switched. We implemented managed services over our firewalls. So right now, as of today, I have 24/7, 365 monitoring by people, security engineers, watching my firewall every minute of the day. I also have managed detection response with Kroll, with Carbon Black running on all of the endpoints, 24/7, 365, every minute of the day. I also have SIM technology. So I've got every log that happens in the organization is monitored and sent to a SIM where I have another team of engineers watching that, analyzing that every minute of the day. And this, the reason I talk about the managed services, it's so important to have security engineers, but I can't hire them. I wouldn't want to, right? I mean, I love my network engineers, my server engineers. They keep the lights on. They do all those great things. They do have some touches in terms of cybersecurity because they're monitoring some of these services as we interact with the security professionals. But the importance is having a team out there that is 24/7 watching us every minute of the day, because we want to do what we do, which is healthcare, right? So a month later, this is February 26th. This is what our environment looked like. We had segmented. We had moved things to the cloud. We have replication from San Antonio, Texas to Lebanon, Ohio, 2 data centers. We have disconnected backups. All of this technology we put in place within a month. It's amazing how much money your organization will spend if you get hit by a cyber attack. So, and how much control I get because prior to that, we're healthcare, and healthcare doctors are doctors. And if you've ever dealt with one, I know one of my corporate director of informatics is back there, and she deals with them all the time. But they want things their own way, and they don't really care about all this cyber stuff. They'd love an open network. Constantly they're asking me to put Gmail. Why can't I log into my Gmail account inside the hospital? Because I don't have a gateway that covers everything that's coming in from your crappy email through public Gmail, right? So it gives you authority to be able to say no and put things in place that are appropriate to secure the environment so that we can do patient care. Luckily, Kroll did the forensics. There was no breach of PHI. So they were not able to see any of our information. They did lock up some, but they never exfiltrated any of it. So we did not have to report any kind of breach, which is, why I'm still the CIO over at M&E. No. We also, and these guys, the forensics guys from Kroll, they're amazing what they can do in terms of this technology. And if this is the area you guys are going in, hey, kudos, because they were able to trace the steps of the hacker across multiple machines, where they went sideways, what directories they touched, which is awesome, right? It was like, wow, they knew exactly where the hacker went, what they did, what they touched, which directory they went into, where they deployed the virus, how they did it. They determined that the first access into our environment was on the 23rd. So on a Wednesday night, they got into the environment and watched it for 3 days to learn our backup process, to learn our replication process, understand what they had to hit when. And one of the things they love to do is do it on a Friday night. So at 10 p.m., we know that they started their activity by escalate. They went. So island hopping is a technique where they steal credentials and they go from a less protected environment, elevate using schemes to a more protected environment. So one of the things about healthcare, and the prior speaker, he talked about legacy systems. We have a lot of old technology in our health systems across the country. Everybody does. Healthcare is very capital intensive in terms of it costs a lot of money to run like an MRI machine or to buy a PACS system, so that when you want to upgrade some of these, it's like the lifespan on some of them. The system that actually got hacked, it's been replaced, but it was a respiratory system that only could run on 2003 server. And this was 2019. So they found this using the credentials from the doctor that they stole, most likely in an airport in England, when the doctor uses the free Wi-Fi at the airport. Never do that, because the guy sitting next to you could be a hacker and he's stealing your information. So they logged in, got into our systems, went sideways, found the 2003 box, and set up command and control using Cobalt Strike. Started deploying across the network, watching what was going on from that standpoint. And we know that from the forensics. So it's scary, but that's what they did. Since then, we've implemented two-factor authentication across the board for all remote access, external. We are currently activating that for all internal is two-factor. So even if you're inside our environment and you have elevated privilege on an account, you have to do two-factor to get onto a server. We reduced our footprint for products in the DMZ and then implemented disconnected backup. So how am I going to do on time, Eric? Okay. Yeah, I'm just about. So all of these things that we put in place to from the lessons learned of the attack, right? And you learn a lot if you go through it, and hindsight's 20/20 sometimes, and it's like I'd only done X, Y, and Z prior to this, it wouldn't have happened. But in the end, it was good that it happened because it woke up the organization and said, we need to make this a priority if we're going to do healthcare. And we have. So where are we today? Or why don't we just go to key takeaways? Adopt a cyber framework is key for an organization. And as security engineers, you should really understand what the NIST framework looks like. They actually have had it's in draft form for the new version. They've added another section for governance, which Eric's going to actually speak to. And then the importance of educating everybody in the organization on cyber is huge to make sure they understand what it means to click on that thing or download that thing or share on social engineering. Artificial intelligence right now is going to make it even harder on us because the hackers are going to just look at social engineering, look at our social media sites, understand who we are, and then the next thing you know, they're creating emails that look like it's coming from the CEO, or even the CIO, right? So that's the future. It's going to be bad, so we need as many security professionals as possible. Right, Eric? All right, I'm going to let Eric take over here. And he's going to talk on governance.
Oh, thank you, Dan. So first of all, thank you for having me here. My name is Eric. I'm the friendly compliance officer at Emanate Health. I'm not going to talk about the technical stuff here, but basically just give you a little flavor of how it looks like and how cybersecurity looks like in healthcare. So I don't have any technical background or I don't have any degree in technology, but I have a degree in information management. I oversee privacy and security at Emanate Health. I mean, the privacy and data security oversight responsibility. Dan is our person in charge of our, to figure this out, on the technical piece and cybersecurity piece, but we complement each other. I just need to learn how to move this real quick. But oh, there you go. So basically, I'm just going to talk about the value of cybersecurity. And at the end of the day, this is the only slide I'm going to talk about. It's really critical that you need to be able to have the skill set to how to communicate to your leaders the value of cybersecurity. This is like what the keynote speaker was saying earlier about how do you play in the sandbox. So yes, you could have the most advanced technology in your system or environment, either it be you decided to go in healthcare or banking or any kind of industry. But if you don't have the tone of the top in terms of how well cybersecurity should be, or the value of securing your data or your information in your environment, if you don't have that tone, it's not going to work. And that's the reality of it. And yes, and what we have experienced over at Emanate Health, in spite of the cyber threat the cyber incident that we had, is the strong support and commitment from our leaders, adding the strong support and leadership of Dan and making sure that we have the necessary infrastructure in place. And all of those really have to come into play, because you could establish your goal and your plan and how to execute a good program. But if you don't have that tone from the top, from your executive, starting from the board of directors to the president, to the CEO, being able to echo the message of your chief information officer on what needs to be done, it's not going to work. So it's critical that you future leaders, and I'm speaking to you students, because this is basically what you're going to be at in the future. And it will be just a matter of time or years for you to get to that role. But please understand or get the skills that you need and how you communicate and how to relate the value of data protection in your environment. So you talk about policies, and these are the good stuff that you need to have. You need to make sure you have written standards. You need to make sure that you educate your people. You have internal controls. Dan showed you different metrics, the NIST standard that we follow. You put that in place because that's part of the work and function that you need to do. But the key here is how you communicate that to the front line. Okay, so how would they be able to perform those standards? You could write the best policy and procedure in the world, but if the people you're trying to educate or make them do it don't understand it, it's not going to work. Okay, So my point to you is, as you grow in your career, communication is really important. Being able to relate there, I would recommend study even the so-called emotional intelligence. So you target specifically what the things that will motivate them to move forward, what will motivate them to work with you in enhancing data security. Metrics, make sure that you measure. It has to be real. It has to be something that is tangible. It's not just a concept, because your leaders will depend on you, on your skill set and your knowledge that you are securing the environment. But if your measure of performance is not accurate, it's going to compromise everything that you're trying to do. And I talk about staff education and the value of having a strong and consistent. Continually evaluate and measure your performance over and over again, because that's also critical. And make sure that you have proper reporting that that will make all of your initiative visible. Regulatory mandate, these are some of the rules, privacy rules in privacy and data security that I think if you would like to grow in healthcare, please read through it. Again, it's not technical, it's more regulatory, but it's important for you to understand it, because in healthcare, this kind of drive the protection standard of our framework that we need to do. So in California also, these are the list of the privacy rules that we also need to make sure we have to be aware of, including other states. So when we had, in our environment at Emanate Health, we are solid in our infrastructure, but we're also vulnerable on some of the data that we also share with other vendors. Just like in any industry, think about banking, think about grocery. Some of the information that those industry or company perform has also to be done or shared with other entities like payroll. So those information of your employees or your customers that you're sharing, you need to make sure that they're also protected. So make sure that you also understand the rules governing those data, including rules governing other states or mandated by other states. Dan just mentioned about the breach in Change Healthcare. As I said, it's not in our environment, but this is really in outside environment, but we share our data and it's affecting us significantly. And in healthcare, we're not really, healthcare, as you know now, is not really a moneymaker industry. We do this for patient care delivery. But if you added more factors like this or threat like this, it could easily bring down any healthcare businesses. So here are some of the most settlement and penalties. Not only that the cost of cybersecurity is expensive, let alone the insurance, but the penalty that you'd also get for not complying with those regulations is impactful. Okay. I said about the vendors and the contractual requirements. We need to make sure that there are also certain requirements that under the federal and state laws that also needs to be complied with. Again, the framework is always harnessing your skills, harnessing not just the skill, but harnessing the infrastructure that you need to have a strong cybersecurity program, build in a knowledge base that you're learning now, because you will need that. But as Diane mentioned earlier, and Andrew and Dan also pointed out, the risk, cybersecurity risk is actually evolving. It's changing, constantly changing. But the soft skills is really important. How you communicate, how you interact, and how you move people from point A to point B, making sure that cybersecurity is not just a vision, but it's really a reality that needs to exist in your environment for you to be successful. Okay? And cyber attack, again, what Dan said, it's a matter of when, not if. It's going to happen, whether we like it or not. And as more people depend on technology, we do that in healthcare, although we're kind of late compared with other industry in applying technology. But the healthcare industry in general are now realizing the value of technology. AI, for instance, how you do a diagnosis, but dependency on that create threats. There's so many bad actors out there, and many of those bad actors are influenced by different factors. But the biggest one are the nationalistic influence of different countries. They just want to bring down the United States. And one way of bringing down the US is bringing down the healthcare infrastructure. Healthcare budget in the US is number 2, just second to the national defense. So you bring down healthcare, you pretty much crash the United States. So it's really some motivators out there. Again, leadership. So learn about skills and leadership, communication, that's really important. And always be prepared. So that's the main concept that we're trying to share with you. I hope that I hope for you guys is to grow interest in healthcare, particularly in IT and cybersecurity. There's always a growing need, also in the regulatory side. But I thought that this is really promising. Even my nieces and nephew who started to go to school, I've been introducing them to cybersecurity. The value of cybersecurity and healthcare delivery is really important. These are indirect functions to healthcare, but it's really critical because the delivery of healthcare now is dependent on technology, access to information, portability of the information. So grow. My advice to you is grow in your skill set. Really excited for your growth and finishing your studies. Get all the necessary training and necessary credentials that you need. But consider healthcare, because healthcare is really in need of cyber expert, either be within our environment or through other companies that provide services to healthcare industry. So I'm going to pause now to give us an opportunity, anybody to ask questions to me and Dan, or any comments from anyone. Yes. Can you say that again? I'm sorry. Oh, that's good. That's a good question. Dan, want to put a stab on it? So for me, before I give it to Dan, it's you really need to evaluate the condition that you have in. Like, for instance, what Andrew was saying earlier, the different type of attacks that you're seeing whether that be in healthcare or whatever in business that may be. You adjust to it and you adapt, because maybe you need to evaluate your workflow, your processes and procedures, and how things are being delivered, and identify gaps that could be potential areas of risk. So, and sometimes I could say from the regulatory standpoint, some of the regulation will change and you have to adapt to those rules. And some of the missteps could happen that could create some vulnerabilities. Dan, want to add something to that?
Yeah, and in terms of the threat landscape, that's what drives it as well. So we will constantly look to our managed service providers to understand where things are changing and what we have to put in place to manage those. We do regular conversations in terms of our capital planning as well, to sort of say, okay, what can we afford now? As you saw earlier, I focused initially on the response, but over time, I mean, that's not what we look like today in terms of the NIST framework. As of today, out of the 22 measures that are in place, we're 83% on the 22 measures to almost a 3. So we've got like 3 or 4 that are left. Now, some would say, oh, 83%, oh, that's just a B, you know? Me, from the perspective of school, I'm like, hey, my board, they grade on the curve, so I'm okay. But yeah, I mean, it's really looking at the threat landscape. As we look at generative AI right now, that is absolutely what we have to worry about. So Russia right now is employing AI-sponsored cyber attacks against Ukraine. They deliver that to their local hackers in Russia to then use on us worldwide, because it's a business in Russia, right? So I was talking to some security professionals, and one of the things I asked them is like, okay, you guys are developing the response to the AI that's now been released by Russia to their hackers. When do I, in a health system, expect to have that next level of defense in place? He says to me, oh, maybe 6 months from now, you'll get something. So hence why I don't sleep. Or, I'm practicing my next role, which is, you want fries with that? Anyway.
To that point too, and Dan actually just taught us that, actually cybersecurity, the standards that you meet, it's really a moving target, right, Dan? That you're measured on one thing, and the next year, because of the different threat environment and vectors that are out there, you have to continually adjust. So evaluation and assessment is really critical, and building those knowledge base on the technical pieces to it, and also the regulatory pieces that will enable you to understand how to navigate around it. Like, yeah, meeting the standards, just like could not. We have to educate and tell our board leaders that that this is not just a target, but it's really a moving target and an aim that we need to do every day.
Does anyone?
Well, I hope you guys will consider healthcare.
Any questions on Zoom? Thank you so much for your time,
Thank you.
Andrew. We have a little token of our appreciation.
Thank you so much, Dan and Eric, for coming and talking today. We do have lunch right now. It's being served outside, so if you weren't able to grab lunch, please go outside. And then we also are starting our next speaker that's happening in the other room, and he's going from 1 to 1:30. And then we'll start talks in this room again at 1:30. Thank you.